Depression has the strongest effects on women, according to a study by DeWitt and Ma and Shao in 2010, and is the leading cause of disease-related disability among women globally. According to a study by Kessler in 2003, a lifetime risk of MDD varies from 10 to 25% in women with a peak prevalence of 25 to 44 years of age. Although treatable, it can be under-recognized or undertreated in clinical settings. Antidepressants are also costly, and side effects are still important barriers to treatment, according to a study in 2004 by Casano, Fava, and Simon. In recent years, growing evidence suggests a complex relationship between diet and depression. Diet may have impact on development and the course of depression, as well as cases with depression in turn may develop unhealthy diets. The overarching aim of the study was to determine the effects of dietary pattern on depression in its frequency and depression episodes. The study took a constructivist approach, which in contrast to a positivistic approach, assumes that it is possible to tend to various points, not just one, of this complex relationship between depression and diet. Data from the interview was coded manually, then a thematic analysis was done after the first cycle coding, after which it was validated further by second grammatical coding method during the second cycle coding. We coded the interview transcripts first by exploring various methods of coding based on hunch-driven queries. We wanted to provide deep insights and wanted to go beyond the textual meaning of our analysis. Therefore, we applied magnitude coding to the dataset for an extra layer to the rather discrete or non-continuous dataset, but within a scientific contrast. Shift in dietary pattern. Both respondents mentioned that their diets and the type of food they have eaten changed drastically, including in frequency as well as in intensity, citing vaguely that eating vegetables often have had positive effects to depression, pointing out that eating meat, for example, chicken, pork, beef, including eggs and other dairy products, had a strange connection to their moods. As to the amount and frequency of food consumption, poor appetite or decreased in appetite was cited as many as 6 times, but which no explanation were given except for a significant difference in their daily activities. As to the effects of diet and depression and vice versa, we identified notable associations between dietary patterns and changes in their states of depression. Although respondents were uncertain whether their diet has an effect on their mood, their counts tabulated showed otherwise. The numbers showed that their depression had lessened as their diet got better.